It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back once again with another edition of the Best Docs Network. Of course, featuring some of the best physicians in all of the Dallas-Fort Worth area that are helping to change people's lives.
And Candace, today on the show, the folks are going to enjoy this because we have a number of outstanding physicians that have unique procedures helping individuals. Like our first doctor, it's Dr. Cesar Duclair that helps individuals relieve back pain in a unique way.
My experience has been a 12-year journey. I've had 13 ESIs, which are epidural steroid injections. I've had an L5-S1 disc replacement, and it just never seemed to help with the pain that was radiating down my left leg. It even caused where I would trip and fall. I had a lot of problems with helping out with my kids, lifting my kids, being a mom.
It was decreasing her ability to work, decreasing her ability to socialize with friends and family. She had started to not be able to do the mundane tasks of life.
Dr. Duclair had asked me, well, what do you think about this device? And he kind of shows it to me. I said, well, what is that?
A lot of patients will qualify for a device, what we call a spinal cord stimulator. And that is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. And that is a great way for patients who have had surgery and are dissatisfied, or they've had injections and medications and they're still dissatisfied. Those patients can get really great relief, and they can ultimately decrease their pain for a long period of time, on the order of years, and then decrease their office visits with their doctor and become very, very satisfied and very happy with that.
I have a little remote control device. I can turn it up, I can turn it down. I like the fact that I'm in control of it. I have pain freedom now because of the device.
Amy did really, really well. She has total pain freedom. She does not see me anymore in the office because she does not need to. She's not taking any medications. She essentially has no more complaints of back or leg pain.
I'm just very blessed, very, very blessed that he's in my life, because without him, I don't know that I would have the pain freedom that I have today. So I believe that God puts people in their life for a reason.
On a day-to-day basis, I was experiencing chronic pain, chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff teenage girls do during high school, just because of her chronic daily pain. And so we decided she was a good candidate for the trial. And then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so. And Dr. Reed decided one day to somebody with headaches to try putting a stimulator over the peripheral nerves that supply around that scalp. And the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80, 90% relief, that was real dramatic. And that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm, going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
For more information on any of the outstanding doctors you see on today's show, head to the website. It's bestdocsnetwork.com, bestdocsnetwork.com. That is the place to go to check out all the doctors' fine work. Right now, the place to go is our next best doctor. It's Dr. Carol Norton.
My cycles used to last, maybe 3 or 4 days, and they started lasting longer, sometimes a week and a half. And it was physically draining, and mentally, I would just be in another world.
There are two minimally invasive procedures that we offer in the office setting. One is endometrial ablation. So this is a treatment procedure for heavy, painful periods. It is designed for those women who are done with childbearing and don't want to continue to be on medication to control menstrual cycles, don't want to have aggressive surgery like a hysterectomy for their menstrual cycles, but yet are having problems every month with their cycles.
We discussed different options, and she told me about ablation and exactly what the procedure was and what the outcome could be. And then I went home and did some research on the net, and then I finally had enough, and I called her up and told her, you know what, I'm going to go ahead and try it and just see what happens.
I basically counsel patients that if they have ever had to change their plans because of their menstrual cycle, they ought to consider a treatment of some sort, and this is a very, very good one for those patients who just want a one-shot deal and they're done.
The procedure was quick. I was in and out, went home, laid down, and the next day I was fine. I got up and was able to do my usual stuff around the house.
So they come in, the procedure takes pretty much an hour door to door. We do an IV sedation. They go home, and by the next day they're usually completely over the effects of the surgery and anesthesia.
There was no cramping of any kind, just slight bleeding, and that was it. I didn't have the terrible headaches that I had prior and during, and my second cycle I had no symptoms at all. No bleeding, nothing. In my opinion, the best thing I ever did.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
This Friday, I'm going to have a gastric bypass. I chose the gastric bypass surgery because it has a higher percentage rate of reversing diabetes. And I would have loved to have done it by myself, but I need all the help that I can get. Because I'm looking at my lifespan and my quality of life. And if I don't put a stop to it now, then what does my life look like 20 years from now?
She's been overweight for a long time. She gained a lot of weight right after pregnancy and tried to lose that, wasn't real successful, and then she sort of became the caretaker for her mother. So she gained a lot of weight during that period of time.
I tried different diets and I tried some lifestyle changes without success. I mean, I'd get a little bit here, but then you'd gain it all back. And I became diabetic.
She's now trying to get back to being in better health. So she's been through the weight management program. She learned a lot about nutrition, and we've started her doing some exercise things. She's been to a psychologist and learned some more stuff about herself and how to deal with things, how to change habits, how to deal with stress with other things other than eating. It's really hard for people to lose weight on their own. It's really hard. And it's really kind of unfortunate because people look on the internet and they read blogs and things and they say, this guy, he lost 60 pounds in the first 2 months, and I think, oh my gosh, the guy's gonna die. But they think that that's wonderful because in today's society, what do we want? We want to be thin tomorrow, right? No, it's not gonna happen. It's not healthy to do it.
I'm looking forward to getting on a water slide, getting on the airplane without a seatbelt extender, getting on a roller coaster without thinking that the bar isn't coming down far enough and I'm gonna flip out. I am looking forward to climbing up the stairs without paying the fat girl tax. And this is gonna be great. This is gonna be great.
Roger had a traumatic spine injury that kept him from walking until he met Dr. Rebecca Stachniak. To find out more about Roger's story and other life-changing stories, log on to bestdocsnetwork.com.
I'm a board-certified allergist, and I treat patients with allergies, asthma, and clinical immunology problems like immune deficiencies. The scope of practice of allergy covers people with things like hives, frequent infections, itchy, sneezy eyes, nose, throat, a lot of coughing problems and asthma problems, chest problems related to their allergies. The Dallas-Fort Worth environment is very good at producing pollen, and we have probably more patients come in complaining of pollen allergies than any other type of allergy.
Prior to coming to Dr. Baxter, I tried several other things, but really I was doing self-medication, just pretty much living with what I was having to put up with, thinking this is just the way it is and I just have to deal with it.
Michael is a person who's had allergies pretty much all his life. They've been severe. He just wasn't able to stay well. He would have very frequent ear infections and basically stayed infected. I think his sinus infection never really cleared up. So we tested Michael. He is very, very, very allergic to just about every pollen that there is. And I remember his back was just very, very blown up with big reactions. And so to tackle that requires careful formulation of his immunotherapy and faithfully taking the shots for quite a long time to actually get the treatment up to the level that you need it to be to really give him protection.
If I have an infection or a cold or anything, I really don't even get that bad with those infections. So it just changes your whole lifestyle and your whole perspective on things.
His allergies were causing the frequent infections that he was having. And he's really not having those anymore now that he's taking his shots, and his shots have been able to be built up to a high dose.
My life changed a lot after having the shots because I went from having to take antibiotics once a month to about every 3 months, and then now it's the rare occasion that I have to come in and see Dr. Baxter for any infection medication.
For more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. And Candace, right now we're going to head to a couple of doctors that help individuals relieve foot pain.
That's right. We're going to go visit with Dr. Holcombe and Dr. Williams over at North Texas Foot and Ankle, and we're going to talk about diabetes and foot care.
Diabetes is a systemic disease that affects multiple organ systems, and in particular, it affects the feet. The main complication that occurs with diabetes is something called neuropathy, which is where the patient loses the sensation in their feet. Once that occurs, they are at risk for pressure calluses, ulcerations, infection, and possible amputation.
At the end of November, I developed a blister on the bottom of my foot that then turned into a diabetic ulcer, which then caused an infection in my bone, primarily my big toe, and had to have my big toe extracted.
A lot of people don't realize that there are over 75,000 diabetic foot amputations a year. Of those diabetic patients that have amputations, 68% have a 5-year mortality rate.
Pauline came in, and because the diabetes was so out of control, her ability to heal these pressure ulcers on her feet were severely limited, and that's one of the main problems with being diabetic is your ability to heal common ulcers or pressure areas.
I didn't realize how bad it was, and it can just come on you, and if you don't get it taken care of, then it will lead to not just toes, but your feet and your ankles and your legs.
Another thing that diabetics are prone to is peripheral arterial disease. This is poor circulation in the extremities. We have modalities here in the office that we can help assess for these risk factors. For example, we have a peripheral arterial test that puts blood pressure cuffs around your arms and legs, and what it does is assess the amount of blood flow that's getting to your extremities. By this, we can help determine whether there's further intervention that's needed. So if you do end up having a sore on your foot, we can address it and it will heal properly.
We are now seeing Pauline much more frequently for regular checkups and providing special shoes and inserts as well to prevent further pressure areas from developing.
I'm feeling stronger, and finally I'm getting to the point where it really is important to take care of it.
Everyone should know what their BMI is. That's your body mass index. It's a measure of obesity. You can calculate this through a very simple formula that you can find on the internet. And what you're looking for is a number under 25. 20 to 25 for your BMI is normal. 25 to 30 is overweight. If you're above 30, that's obesity. If you are in the obese range, you want to bring it down into the overweight range. If you're in the overweight range, you of course want to bring it down into the normal range. And obesity and a high body mass index is a very important thing to know about because it can affect your health. There's 26 types of cancer that are affected by obesity, as well as things like arthritis of the knees, hypertension, diabetes, sleep disorders. There's a whole lot that can be improved by improving your body mass index. So know what your BMI number is, try to get that number down and shoot for a number under 25.
Breast reduction is a very common procedure in the United States. The reason being is that there are many women in the United States whose breasts are larger than they should be due to hormonal responses in their body. And when the breasts get that large, it starts to become quite a problem for them on many fronts.
Ever since I was a kid, I knew I had big boobs. Initially, I thought it was very enhancing and I loved it, but then whenever a D got to an E, when an E got to F, when an F got to triple H, and I was like, you got to be kidding me. Prior to having my breast reduction surgery, I had a very hard time walking around. Running was like next to impossible without actually being excruciating pain and feeling like I need to sit down.
Jennifer was one of the first patients that I saw here after I came to the area. She's a very nice girl who had a very common problem of having extremely large breasts, so large in fact that it really affected her daily life. She had almost constant pain in her neck and her shoulders. She found it very difficult to find clothes that would fit her appropriately, and she certainly couldn't do any type of exertional activities because of her very large breasts. I saw her here in the office. I found that she was an excellent candidate for a breast reduction procedure. We scheduled her procedure and we did her surgery. She was able to go home that same day. She did very well in recovery, and now she can do her daily activities without these constant feelings of pain around her neck and her shoulders. And I think that her quality of life has been improved quite dramatically by this procedure.
I have been able to be an active participant in my son's life. I'm able to go and join my friends out and actually not want to sit down every 2 or 3 minutes. It's unbelievable to think that a breast reduction can actually help you regain a sense of life, but Dr. Hermann helped give that to me.
Now let's take a closer look at the Lifeworks Group. It's a collaborative group of counselors that help individuals with a variety of issues, including their mental, physical, and emotional health.
Before I came in, my life was really kind of in shambles. I didn't know where I was going. I was hurt. I was in a lot of pain. Really numb. This was the last-ditch effort coming here to Lifeworks. I had been referred to Melanie Wells.
I had been working in a variety of different practices for years, and I'd worked alone. I'd worked alone in a group. I was really frustrated by the lack of collaborative input. One day I was driving along Lover's Lane and I saw some space, and I thought I just had this vision that I wanted to have a collaborative team to work on cases together. Collaboration for us involves complementary specialties. There are more than 20 people on staff, and we try to thin slice our specialties so that we're not competing with one another, we're working together as a team.
My first impression of Lifeworks was this is very different than the other therapist office that I had tried to go to. Not so clinical, not just very relaxed, very easy. The people were very easy to talk to. It made you feel very comfortable and welcomed.
I try to look at a case from every possible direction, and as the clinical director, I'm going around the room making sure that I hear from anybody involved in an area of that case that might have something to offer. I want to know what everybody else thinks about my cases. Having 20 people in the room that have 20 different points of view is extremely helpful to the clients and to all the therapists involved.
One thing I really like about coming here is that I kind of get more than one therapist at a time. They take the time and work together, maybe discuss my issues. It completely feels like I'm going to a friend that knows exactly what's going on to me. So easy to talk to.
We believe that therapy starts with the phone call. So when a client calls in, we want them to feel welcome and we want to be able to give them exactly what they need. Part of my vision for Lifeworks is to train therapists well, but also I want to be able to offer services to a wide range of individuals. I don't think money should ever be the reason not to come to therapy.
I don't even know how I would thank Melanie for what she has done for me. Words are not enough. It is invaluable what she has done. I love her to death. She's fun and just a really sincere person.
I had injured myself working out at the gym. I thought I'd just maybe tweak myself. And then I went to playing soccer a couple of weeks after and took a nasty fall. I knew I had done something drastically wrong.
90% of the people that have a disc herniation or back pain don't need surgery. And that's the first thing that we want to remember is we want to get you well without a surgery first.
He was pretty certain that I'd herniated my disc from just the symptoms, but he needed that MRI to make sure and rule out anything else that was going wrong in there. And he immediately gave me some medicine, to take care of the pain and get me through until any of the medicine would just subside the pain and I could move on with my life and not have to do surgery.
Vincent came in and had leg pain. We found that he had a disc herniation at one of the lower levels in the lumbar spine. We initially tried to treat it conservatively with therapy, injections, however, he didn't really respond to that. So in that case, we took him to the operating room and performed a minimally invasive surgical procedure on him.
I really had to weigh my options and see if I wanted to really do this or not and take the gamble. and I'm really glad that I did.
The goal is to become pain-free when you have a disc herniation or back or leg pain. What we do is we want to address it first without any type of surgery. We want to try and treat it conservatively, but if not, we want to use the newest and the best and easiest method that will take care of your problem. In Vincent's case, the minimally invasive approach was the best way to deal with his issue that he had.
And basically what he was wanting to do is just make an inch to an inch and a half incision, dissect down to the actual disc, and remove the bulged part and a little bit more of the disc to prevent any future herniations.
Minimally invasive surgery has changed the way we're doing spine surgery. It decreased your time that you spend in the hospital, decreased your pain, decreased your blood loss, and also decreases the time that you have to spend off work.
I have no regrets of doing this surgery whatsoever, because the pain that I was in to being pain-free now is amazing.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I had no energy. I was limp. I just barely could put one foot in front of the other. Every day was just a difficult day to get through. All I wanted to do was just to crawl into bed. I was so tired. I was also having some heart palpitations and flutters, and that was scary. I could tell something was wrong. So I went and saw Dr. Worrell.
Sleep apnea is really sleep apnea with hypopneas. There are two different parameters we look at when we're doing sleep studies as far as sleep disordered breathing. There's the pause in the breathing for 10 seconds, which constitutes an apneic episode. In a hypopnea, you don't breathe well enough to get proper ventilation and your oxygen level actually drops. So for people who every 2 minutes don't breathe well enough to ventilate their body, then we call that a severe sleep apnea. Severe sleep apnea is associated with various kinds of heart problems.
Dr. Worrell suspected that I probably had a form of sleep apnea, and he prescribed a sleep clinic, and it came back that I was borderline. So we waited for a little while more and did another one, and finally it came back that I was full-blown sleep apnea. And they, of course, said, you've got to have a machine.
A CPAP is kind of a necessary evil sometimes. Some people will adapt more easily than others, and for those who do adapt to it, they are the ones who are the most appreciative because they see the quality of life improvement. They wake up and they're not so achy, not so stiff in the morning, that they have more energy, more stamina, that they just feel better overall.
Within 2 weeks of getting a good night's sleep with a CPAP machine, I was back to 100%. I was like, it's a miracle. It's just absolutely a miracle. I think Dr. Worrell is probably the best doctor I have ever gone to. He partners with you for your health issues. He's not condescending. He listens and very, very gently pushes you in the right directions that you need to go for your health.
Well, that'll do it. That'll wrap up yet another edition of the Best Docs Network, featuring some of the top physicians in all of the Dallas-Fort Worth area that are helping to change people's lives.
And of course, for more information on any of these great doctors in the Dallas-Fort Worth area, head to the website bestdocsnetwork.com.
And as always, if you have a question or a comment for us, or if there's a doctor that's helped change your life, we sure would love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.